We're going to cover a few techniques, soft tissue work, that you can do if you're experiencing pain in your TMJ, your temporal mandibular joint. Okay, now some symptoms of TMJ dysfunction might include chronic headaches, chronic neck pain, ear pain, of course, pain directly in the joint itself. We're going to start with some external soft tissue work. So I love to start with the temporalis muscle. All right, now, of course, starting in the area of your temples, use as much pressure as you are comfortable with. You will likely very easily be able to tell if this is tender. I will start with my fingertips, and of course, I'm going to traction up on whoever is on the table here. But when you're at home, you can massage. You can also take your fingertips and just push straight up and inward, of course, to apply the pressure. So that's what I'm doing with Dr. Paige here. I am going to have her help me. We're going to work together. So Dr. Paige, I want you to slowly open your jaw for me, and I will apply pressure and pull up through the temporalis muscles. Great. Let's do that one more time. As she is opening her jaw, I'm applying pressure upward in the opposite direction to help stretch through that muscle, a little pin and stretch. Now, your masseter muscle is most commonly known to just be in your cheek area here. It helps you chew. So you can find your cheekbone and apply some pressure with your fingertips. Just rub. This can be a little bit of a circular motion, massage. You will likely find that this is really tender in the angle of your jaw. So, coming down to the angle of the jaw, again, using as much pressure as you're comfortable with. It might feel really good to just use your thumb and push straight up and back, whatever you need, okay? Now we're coming behind the angle, behind the ramus of the jaw, just below the ear. So as Dr. Paige relaxes here, I can very easily just push up on that area. Your digastric muscle hides back here. You can very easily find this yourself with your thumb and just push forward, okay? Massage, give a little wiggle in there, a little pin and stretch. You'll know if it's tender or not. Work at these as you need. Now I also like to take some lotion, and we're going to work on the neck musculature, of course, because of its relationship to the head and neck and jaw. I will use my thumbs and just work through the scalenes. I have an alternative way for you to do this to yourself at home if you don't have someone to help you or if you're not in the office. Take both hands, find your collarbone, and just pull, traction that tissue down, and then you can look straight up. You will feel the stretch through the front of your neck. Now we're jumping into soft tissue work inside the mouth. So of course I'm wearing gloves, but if you're doing this to yourself or even you're little, you don't necessarily have to. This first piece here, we're going to be coming straight back towards the TMJ joint itself. Now I will use my index finger and I will be right in between the upper lip and the gum line. So it looks like this. I'll have you turn to your right just a little bit. Beautiful. Right in between the gum line and the TMJ, nice and gently, I will come back. And I almost just create some half moon sweeps outward to help stretch out this tissue. Is pressure okay? Now I'm pushing straight up and back towards the joint. Just some nice soft tissue work, trigger work. You can almost create a little circular movement or even just like some vibrational therapy to help the soft tissue relax. I love to also pin on the outside where her joint is and then traction down on the outside of her cheek. So I'm also pinning on the outside while I'm working on the inside. Pressure okay. You can work through 3 to 5, 8 to 10, whatever feels best for you. We have an activator. That is our little clicker tool. What's really beautiful about the activator is that it gives a very light amount of pressure, which of course we can change, but this is so gentle that we use it on pediatrics as well. Of course it makes a little bit of noise, but it delivers just the same amount of depth or amplitude with each adjustment. So this can be used very gently on the TMJ joint itself if necessary.